Welcome. My name is Donna Peeler. I am the Program Director for Cystic Fibrosis Review, and I am here today to have an interview with Ella Balasa.
Hi, Donna. Thanks for having me today. I am an adult living with cystic fibrosis. I'm 29 years old, and I am seen at the VCU Adult CF Clinic in Richmond, Virginia. And I've been working in patient advocacy the last couple of years and really know and understand the value of having patients involved in their care with their care teams and just throughout the development of new research and product development too.
So I know we'll get into a little more detail about maybe the definition of patient advocacy, but I think we'll start with some questions, and that may help bring out what it is exactly we can do to improve this. I guess from a care team perspective, in what ways could clinicians and the CF care team better support patients to encourage this shared decision-making and care?
Yeah, I think first and foremost, physicians must really respect the patient autonomy and really understand that ultimately the patient is the most knowledgeable on their own health and what might be the best care decisions made together. But to facilitate this, I think the patients have to feel comfortable in relaying their experiences and having this collaboration and this environment to do so. I think encouraging for the care teams to encourage patients to gain more knowledge, ask questions, and be more involved in their own care, and encourage them to make these decisions together. And some of that, would involve needing perhaps, additional educational resources outside the clinic setting, and maybe providing that and facilitating that to improve patient knowledge overall. And I think, and then ultimately to remember that when you have more informed and more eager patients who are willing to take more responsibility for their health, that ultimately improves their health overall in the long run, and just facilitates a better patient and doctor, or better patient and care team relationship over time.
Yes, I agree. That is a lot of really good information. And I could see this, the approach that the clinicians may need to take could vary with the age of the patient, because you're, encouraging some skills that I could easily see a teenager to adult maybe being able to take on, and younger than that, it may be the parent that you're working with. And again, I can tell you that the parents want to be as much a partner in the decision-making for their child's care. So in what ways, I guess, did you seek out some knowledge? I know that the clinicians, they can offer sources. What did you find was helpful as far as where to find information, and was it best coming from your CF clinic, or did you do some research on your own?
Yeah, I think that it is a change over time. It's, somebody is not going to become overnight, completely knowledgeable in every aspect of having CF, and always knowing what is going to be the best decision, or, being vocal about their feelings and their opinions. So yeah, it's definitely something that I have learned over time. And as I transitioned from pediatric to adult care, and gained more responsibility and was given more responsibility for my own health management, whether that was, calling the pharmacies for refills from prescriptions, not having my mom answer some of the questions in the office setting with the doctor, with other care team members, not having her answer the questions that were directed to me. And, I think some of it is her also, as the parent, stepping back and allowing the young person or the child, the young adult to take on those initiatives, even though it may be out of comfort, out of our comfort zone. But I think I've always been somebody that wants the best health outcomes for myself. And I knew in order to have that, I needed to understand a lot of things about my care and to take that initiative. And so I did receive support from my care team. Certainly, I think that they were very open and having an easy dialogue, which is really important. My parents also certainly helped to push me in that way, where they wanted me to begin to take on some of these roles for myself. So I think that's a huge factor too, is the support outside of the clinic setting too, that does play a role. And then I think like I said, I'm just somebody that wants to learn more and is eager to have the best care that I can. So I've certainly just done Google researches. Of course, there's a lot of CF related resources available that I did, look into and did have help. But from the CF Foundation, through smaller patient organizations and just contacting other patients too, other peers that were going through the same thing that I was. So it's kind of a combination of everything, certainly.
It sounds like you were very self-motivated, and I can see in working with patients that are very self-motivated, this can be a little bit easier. It could be a challenge for clinicians, if they are working with someone that maybe isn't as motivated about their care. Are there some things, does it help to have maybe some more personalized information about how you're doing the treatments that are being recommended, and why, that can they show you some data or some information directly about how you are doing? Do you think that would help engage some of this, partnering with the clinicians and maybe inspiring some to become a little more interested in advocating for themselves and seeking some of that information out?
Yeah, certainly. I think that when we are given that kind of information specifically about our own health, whether that's through at-home spirometry data, or other, through like wearable technologies, that we can, see our progress and monitor that ourselves. I think that adds a level of individuality, and then also kind of puts a little bit of the onus on ourselves that we have the ability to have an impact on our health. It's not out of our hands. It's not completely up to our doctors to tell us exactly what we need to do for our health to make it better. We have that ability to, in our daily lives, see the effects of what we're doing that might have an impact on our health. And so I think that it just brings awareness or brings light to the fact that, yes, this is our bodies and we should know about it and we should care about it. So I would agree that, yeah, that definitely is something that is helpful, I think, and for specifically maybe for those individuals who do struggle with, taking the initiative, really wanting to be a part of their care at a very deep level.
Yes, and that can be a process depending on the age, and your health changes over time. So sometimes I could see this partnering being that there's some information that the healthcare providers can provide, and that can be for many different team members. It may be the physician presenting pulmonary function testing or culture results, or maybe an image of a chest CT. And then you have the physical therapist come in and present, a whole different, perspective. And, each team member may be, bringing this information to the patient, but then the patient being able to say, as you pointed out, that what's going on inside your body. And I would think the clinicians need to have that information, and to really encourage patients not to be afraid to maybe question some of the things that they're hearing from the clinicians, asking for more explanation, because they may be either feeling totally fine and it doesn't match up with, maybe what is being presented, or the opposite, that there's more going on than what, maybe is just seen in some of the numbers and pictures and that kind of thing. So I think it's critical that we get both perspectives.
Yeah, exactly. As you said, like some of those, smaller details that, a doctor may not necessarily pick up on, whether, okay, our numbers might look okay, but if our symptoms are not, or, our feelings are not reflecting that, then there is a problem. Then something does need to be addressed. But they might not necessarily know that from just looking at data results from a CT scan, from a chest X-ray or from blood work. So that's why it is so important that we do be vocal about our day-to-day health, and what might feel off, because the better that things can be caught sooner and addressed, the better overall that we're going to be.
How can we improve that relationship between the patient and the care team so that the patient feels comfortable, maybe questioning things or sharing maybe more about how they're feeling? It might be even maybe a little controversial. They may not be doing everything that is laid out in the treatment plan, but they're doing well. So they want to be able to share that. They might want to negotiate some on some of their treatments. How can we, I guess, as care team members, help the patients feel more comfortable in opening up and building that trust?
It is a difficult dynamic, right? It's just depending on even personalities and, what kind of day that person might be having on that particular clinic visit. But I think overall, just having very candid, open dialogue, really being honest from the care team's perspective of, this is what your results are. This is, if you aren't taking care of your health, these might be the consequences, really. And then also, so being transparent and realistic, but also having, a deep root of empathy, because, ultimately the person is dealing with a lot, and it is a lot to manage. And trying to put yourself in their shoes, maybe there is things going on outside in their homes that might be a reason why they may not be that, compliant, or might have certain issues or problems with, being able to manage their care or whatever else. And so I think when a patient can feel like they're heard, I think that helps people open up more, and maybe some of those potentially other underlying issues can be surfaced. And so I think that's just what's important to remember. And then, of course, that by doing all of these things, by being open, by being honest, transparent, and empathetic, the care team might still encounter somebody who is just unwilling to to step up, to do what they need to do, or to be open, or to really be engaging. And then at that point, you have to also just know that you've tried everything you could. And that's just really the most important too. So of course, I know that is the reality, where care teams definitely encounter patients that are very, complicated and difficult, and that's the truth. That's just the reality.
Yeah, and it is sometimes a process. It may not happen in one visit. It may not happen with one clinician. It may be, someone else that goes in, and they may be the second or third person that's been in and engaging with the patient, and then the patient feels a little more comfortable opening up. But I heard you say how important listening is, and really hearing what the patient's saying and showing some empathy, that we don't have to be so clinical and rigid, that it's okay to take some time to delve into some of the patient's feelings and experiences, and and that may reshape what is feasible for that patient to do. And so
Exactly.
to incorporate that quality of care, quality of life, for that patient is just as important as some of the treatments that are being recommended. And that if they feel that they've been heard, and that they're not going to be punished or scolded, or and that actually what they say will be incorporated into the plan, that maybe they'll be a little more trusting and see the importance of that. Is there anything else that you would say to the patient to help improve their confidence in advocating for themselves? I know you've mentioned so many great points, but I didn't know if there was anything else.
Well, I just want to say that summed it up very well with, what the care teams can do for the patients. I really like that. And the key, I think, is the trust. Is when trust is built, I think that there can be really open dialogue, and a lot of progress can be made through that. As far as for the patients, I think we have to remember that, we have to see ourselves as equal partners in our care with our care teams. And this is how, we can improve on our self-confidence to advocate for ourselves too. And to allow that to happen, to build our confidence, I think we need to be inquisitive, eager to understand more about new research and new treatment options, and more about our personal health. Make it a point to ask questions, of course, when there is a certain plan of action, or why a certain medication, or really anything about our care that we have questions about. And then also, as the physicians and the care teams should be open in engaging in dialogue and build that trust. So too does the patients. We have to be open about our feelings and our thoughts, and then this will, of course, foster better communication and collaboration.
That's well said. And I think this past year has been a little more challenging with COVID and trying to engage patients in clinic. Virtual was a little, I think, more difficult to get that kind of personal connection. But you still, I think the key being that we stay in touch, that we keep, regular contact. And then when we do have that opportunity to see patients in person, that we really kind of maximize that opportunity, and that other members of the team as well. I know, even on the research end, with new things coming out and all that, you may hear about them, read about them, but to have a trusted care provider explain some things, even with some of the new things that we're dealing with in our healthcare, that having that trusted relationship goes a long way with helping to explain why, we may need to, take more precautions, may have to do, added things to the treatment plan that maybe, didn't make a lot of sense. But I think once you get that explanation and that the input from someone that you trust, that goes a long way.
Yes, I absolutely would agree with all of that.
So it sounds like we could do better with just respecting our patients' autonomy, and really the encouraging our patients to ask questions, do some research, come to clinic, prepared with some questions or challenges about their treatment plan or new things out there, or why are they not candidates, for certain things. So I think that could go a long way too, even in some of the pre-clinic planning that goes into this clinic experience, with the patients, that it's not just on the spot, that, we can encourage that involvement and questioning from parents and from the patients. And I appreciate your explanation of that transition from pediatrics through teens into adult, that it is a process. And it may be that the parents are the ones asking those questions initially and being that advocate, and handing that over to the patient is very important. Is there anything else, any final words that you would want to say to the clinicians, to the patients, just about the importance of advocacy?
Yeah, I think that we summed up a lot of really great points here, and thank you again for having me. And I guess the last thing that I would say is and I kind of made this point before too, but when we have open dialogue and respect for one another, and the best in mind for each other, then I think that's when healthcare can really improve, and an individual's health can be sustained and improved over time. So I think that's ultimately what we have to do in the long run. So thanks for having me.
Well, thank you. I know there's always so many challenges and obstacles that we have to get through in the healthcare field. So I think working together in a shared decision-making, and patients really advocating for their own health in such a changing environment is so important. So really appreciate your insight. And it's been a pleasure. Thank you.
Thanks.